If you're over 60, there's a high chance you're taking at least one vitamin every single day, maybe even more. You believe it's helping your heart, your bones, your memory. But what if I told you that one of those little pills might be quietly pushing you toward a stroke while you sleep? No warning. No chest pain. Just one moment you're fine, and the next your words don't make sense, your arm won't move, your world tilts sideways. I'm not talking about smoking, bad diet, or lack of exercise. I'm talking about vitamins. Yes, the very things you thought were protecting you. As a brain doctor, I've seen far too many well-meaning seniors harmed by common over-the-counter supplements. And it's not one rare case. It's happening every day across the US. In this video, I'll walk you through 9 vitamins. Many of them you probably take that can silently increase your risk of stroke nerve damage or brain bleeding. You may be trying to do everything right and unknowingly putting your brain in danger. Stay with me to the end. Your next pill could change everything. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. 1. Vitamin D, the silent calcium overload. Vitamin D. If you're over 60 and take vitamin D every day, especially in large doses or before bedtime, you may be unknowingly creating the perfect conditions for a stroke while you sleep. I wish that statement was exaggerated, but it's not. I've seen it happen again and again. Vitamin D is widely considered a must-have for seniors. You've been told it helps your bones, boost your mood, supports your immune system. And yes, it does in the right amount and at the right time. But what most older adults in America are never told is that too much vitamin D, particularly at night, can silently turn against your brain. Let me tell you about one of my patients, Mr. Joseph Harris, a 72-year-old retired school bus driver from Ohio. A careful man, responsible with his health. Every morning, like clockwork, he took a handful of supplements, including a 10,000 IU vitamin D capsule he ordered online. He'd rate it would strengthen bones and prevent fractures. He never missed a day. One morning, his wife found him collapsed on the kitchen floor. His speech was slurred. He couldn't lift his right arm. He hadn't felt sick the night before. No warning. No pain, just sudden, silent catastrophe. A stroke in his sleep. When we ran his labs, the truth hit hard. His blood calcium was dangerously high. His arteries were stiff. His blood pressure was unpredictable. There was no smoking, no alcohol, no poor diet. The culprit was vitamin D toxicity. You see, vitamin D in high doses causes your intestines to absorb excess calcium, flooding your bloodstream, and your body doesn't know what to do with it. So it stores it in your arteries, your kidneys, even your heart valves, hardening them. That stiffness narrows the passageways blood must travel through. And in the early morning hours, when hydration is low, blood pressure fluctuates and oxygen demand rises. It forms blood clots. One clot, one artery, one moment. That's all it takes to steal your speech, your movement, your independence, or your life. Here's the most alarming part. Many seniors believe that more is better. They take 5,000 IU, 10,000 IU, sometimes even more every single day without ever checking their vitamin D levels. Some do it on top of calcium pills or heart medications, unaware that the combination is not just unhelpful, it can be deadly. The recommended daily intake of vitamin D for older adults is 600 to 800 IU. That's it. And even that should only be taken if you are actually deficient, which must be confirmed by a blood test. Anything more, especially without supervision, puts your brain and heart at risk. I tell my patients vitamin D is a hormone, not a harmless vitamin. It affects how calcium moves through your blood. It influences your vascular health, your kidneys, and your heart rhythm. Taking it lightly is a mistake you may not feel until it's too late. Always take vitamin D in the morning when your body can metabolize it best. Never before bed, and never without your doctor checking your calcium and D levels together. Mr. Harris survived, but he now walks with a cane. He goes to speech therapy twice a week. He told me recently, "Doc, I thought I was doing everything right. I had no idea I was pushing my body toward a stroke." That's the part that breaks me because he's not alone. Thousands of seniors across the U.S. are unknowingly putting their brains at risk just by trying to stay healthy. And if that made your heart skip a beat, wait until you hear what vitamin E can do, especially when it comes to bleeding inside your brain. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 2. Vitamin E, the brain bleed trigger. Vitamin E is often seen as one of the good guys. You've likely heard it supports heart health, circulation, maybe even memory and skin. For years, many doctors encouraged older adults to take it, and it became a trusted part of countless medicine cabinets across America. But what I've seen as a brain doctor has made me deeply concerned and frankly shocked. Because in high doses, and especially when combined with common heart medications, vitamin E can quietly turn your blood into a silent danger, thinning it to the point where even a tiny vessel in your brain can burst. Let me take you back to the day I met Mrs. Eleanor Brooks, an 81-year-old retired librarian from Toledo, Ohio. A widow, sharp as a tack, she loved books, crossword puzzles, and baking for her grandkids. She took pride in managing her health. She watched her diet, walked every day, and took her medications faithfully, including warfarin, a blood thinner, prescribed after a minor heart valve procedure. But Eleanor had read in a senior health magazine about natural ways to boost circulation and support memory, and decided to add vitamin E to her routine. The bottle promised natural antioxidant support and heart protection, so it felt harmless. But inside each soft gel was 800 IU, more than 35 times the daily amount her body actually needed. 3 weeks later, she came into the ER, vomiting, dizzy, and confused with a pounding headache. She could barely speak. We rushed her into a CT scan. What we found was devastating. A hemorrhagic stroke, active bleeding inside her brain. Not from high blood pressure, not from trauma, from a single fragile vessel that gave way because her blood was simply too thin to clot. This is something many seniors don't know. High doses of vitamin E act as a natural anticoagulant. That means it prevents clotting, which can be helpful in some controlled medical situations. But if you're already taking aspirin, Plavix, Eliquis, Wararin, or any blood thinner, adding high-dose vitamin E can turn your blood into water. And when a vessel in your brain gives out, there's no chance to stop it. Even more alarming, most over-the-counter supplements contain 200, 400, even 1,000 IU per capsule. And the actual recommended daily intake for seniors is just 15 mg, or about 22 IU. That's all your body needs. But there are no loud warning labels, no pharmacist monitoring your supplement shelf. Most people assume if it's a vitamin, it must be safe. I wish that were true. Mrs. Brooks survived, but she was never the same. Her short-term memory suffered. She walks with assistance now. She once told me with tears in her eyes, "I was just trying to help my heart. I didn't think I was hurting my brain." And that's the cruel irony. So many older Americans mean well. They trust in the idea of vitamins and the simplicity of it, the familiarity, but no one tells them the full story. If you are taking blood thinners of any kind, and you've added vitamin E without talking to your doctor, especially in doses above 100 IU, please stop and get your blood checked immediately. A single capsule may be enough to shift the balance between life and irreversible brain injury. It's not about fear. It's about knowledge. Your brain can't afford surprises at this stage in life. And if you thought bleeding in the brain was frightening, just wait until you hear what can happen when a vitamin meant to protect your nerves ends up silently destroying them instead. 3. Vitamin B6. Nerve killer in vitamin B6 disguise. Most seniors I meet have heard that vitamin B6 is good for your brain or great for nerve support. It shows up on the labels of countless supplements at your local pharmacy. Pills that promise sharper memory, better balance, more energy, or relief from numbness and tingling. It all sounds so positive, so innocent. But what many older Americans aren't being told is that too much B6 can slowly destroy the very nerves it claims to protect, sometimes permanently. I've seen it firsthand. One of my longtime patients, Mr. Harold Jenkins, was a 66-year-old retired truck driver from Kansas. A proud grandfather, he loved tinkering with old engines, telling stories from the road, and staying independent. But over the course of a year, something changed. His feet started tingling, then they went numb. He began tripping around the house. His hands felt weak. His wife thought it might be arthritis, or maybe just aging. But after his third fall, which sent him to the ER with a gash on his head, they came to me for answers. I'll never forget the moment I reviewed his supplement list. He'd been taking a popular over-the-counter nerve support Formula 1 marketed directly to seniors. The label said it helped with brain health and circulation. But when I flipped it over, I saw something alarming. Each tablet contained 100 mg of vitamin B6. He was taking 2 per day. That's 200 mg gainers daily for nearly a year. The safe upper limit for older adults. Just 10-25 milligrams per day. And even that includes what you get from food. Here's the truth. No one puts on the label vitamin B6 is water-soluble, but at high levels over long periods, it accumulates in nerve tissue and starts breaking down the protective sheath around your nerves, like stripping insulation from a wire. The result signals misfire. You get tingling numbness muscle, weakness, tremors, instability, confusion, and in some cases, irreversible nerve damage. In Harold's case, it wasn't age. It wasn't dementia. It wasn't even diabetes. It was a slow, silent vitamin overdose. The most terrifying part, it sneaks up on you. The symptoms come gradually. A little tingling here, a little balance issue there. Many seniors dismiss it as just getting older, but meanwhile the nerves are fraying from the inside out. And once enough damage is done, there's no pill that can undo it. We caught Harold's toxicity just in time. We stopped the supplement immediately. He's since regained some strength, but the nerve damage in his feet hasn't fully healed. He uses a cane now. He no longer drives. And I'll never forget what he told me in a quiet voice during his last checkup. "Doc, I took it to protect my brain. I didn't know I was poisoning it." Unfortunately, Harold isn't alone. So many Americans trust what they see on a bottle. They believe if it says nerve support or brain booster, it must be safe, especially if it's sold at a pharmacy. But the FDA does not regulate supplement doses. Is the way it does prescriptions, and most companies include mega doses of B6 far beyond what your body actually needs. The truth is your nervous system needs balance, not overload. If you're taking any supplement that contains vitamin B6, especially one labeled for energy nerves or memory, check the dosage immediately. Look for anything over 25 mg per day and talk to your doctor. You might be solving a problem that doesn't exist and trading it for a much bigger one. Your hands, your feet, your balance. These are your tools of independence. Once nerve damage sets in, it can take years to recover, if recovery is even possible. And if you thought a nerve vitamin could be this dangerous, wait until you learn how one popular vision vitamin is quietly increasing pressure inside the brain, mimicking the signs of a stroke. If you're still watching and finding these insights valuable, please comment number 1 below to let me know you're here. Now let's keep going with point number 4. 4. Vitamin A pressure on the brain. Vitamin A. For most older adults, vitamin A seems like one of the safest vitamins around. After all, we've been told for decades that it's essential for good eyesight, healthy skin, a strong immune system, and even graceful aging. You'll find it in multivitamins, eye support supplements, anti-aging creams, and immune-boosting formulas. But here's the truth I wish more seniors knew. When taken in high doses over time, vitamin A can quietly build up in your body, raise pressure inside your skull, and mimic the symptoms of a stroke. I want to tell you about Miss Dorothy Simmons, a 79-year-old retired piano teacher from Oregon. She was vibrant, independent, and sharp-minded, still teaching children from her living room. Like many seniors, Dorothy took pride in caring for herself. She stayed active, ate well, and took a few supplements she believed would help preserve her vision and skin. Among them was a high-dose vitamin A capsule. 10,000 IU taken daily every day for years. She'd picked it up from a health food store. No prescription. No warning label. Over time, Dorothy began to experience headaches. At first, they were dull and occasional. Then came the blurred vision, followed by bouts of dizziness and eventually slurred speech. Her family thought she might be having a stroke. She was rushed to the hospital where we immediately began testing, but the scan revealed something unexpected. There was no clot, no bleeding, no tumor. What we found instead was a condition called pseudotumor cerebri, literally a false brain tumor. Her intraanal pressure was dangerously elevated, pushing against her brain, compressing nerves and affecting her balance, eyesight, and speech. The cause: toxic levels of vitamin A stored in her tissues, especially her brain and liver, after years of silent buildup. You see, vitamin A is fat-soluble. That means unlike vitamin C or B vitamins, which flush out in your urine, vitamin A stays in your body. It accumulates quietly, especially as we age, and our liver becomes less efficient. When there's too much, your brain can't drain spinal fluid properly. The fluid builds pressure, increases, and blood vessels get compressed. Some become blocked. It forms blood clots, weakens capillaries, and in extreme cases can cause permanent vision loss, memory problems, or stroke-like episodes. And the worst part, Dorothy had no idea she was at risk. She thought she was doing something good, protecting her eyes, staying ahead of aging, but she was slowly creating a dangerous situation inside her own head. The recommended upper limit of vitamin A for seniors is around 2,500 to 3,000 IU per day, and that's only if medically necessary. But many popular supplements, Pantone, especially those for eye health or anti-aging, contain 5,000, 8,000, even 10,000 IU per capsule, often taken on top of multivitamins that already contain vitamin A. The math adds up quickly, and the damage doesn't show up until it's too late. Dorothy is still recovering. Her eyesight has improved slightly with pressure management, but she now needs regular eye exams and balance therapy. She no longer teaches piano. And in one of our follow-ups, she looked at me and said something that still echoes in my heart. I was trying to protect what I loved. My eyes, my mind, my independence. I never thought I'd lose them because of a vitamin. If you or someone you love is taking vitamin A, especially in combination with multivitamins or skin supplements, I urge you to read the labels carefully and speak with your doctor. You only get one brain. protect it. And if the idea of pressure building inside your skull wasn't frightening enough, just wait until you hear about a common heart health vitamin that seems safe, but can spike your blood pressure overnight and trigger a stroke before morning. Niacin vitamin B3, 5. Niacin vitamin B3, the blood pressure yo-yo. Niacin or vitamin B3 is often praised as a heart helper, a natural solution to lower cholesterol and improve blood flow. It's featured in cardiovascular support supplements added to energy drinks and even prescribed by some doctors in controlled doses. For many older Americans trying to avoid statins or boost heart health naturally, it feels like a smart, safe choice. But I'm here to warn you, when taken in high doses, especially without medical supervision, niacin can silently destabilize your blood pressure, overwork your heart, and even cause a stroke while you sleep. This may sound dramatic, but I've seen it happen. One of my patients, Mr. Frank Miller, an 82-year-old retired postman from Florida, came into my office complaining of strange symptoms. Every morning, he'd wake up flushed and dizzy. His face would turn red, his heart would race, and he'd feel weak or anxious. His wife thought it was stress. His son blamed his blood pressure meds, but to me it was something deeper and far more dangerous. Frank had recently added a heart-healthy supplement he bought online. The front of the bottle said, "Supports cholesterol and circulation," but the back label told a darker story. 1,000 milligimmes of niacin per serving. And he was taking 2 doses a day. That's 2,000 millia of niacin daily, over 60 times the amount most older adults actually need. Here's what many don't realize. Niacin in high doses causes your blood vessels to dilate rapidly, especially near the surface of your skin. That's why you feel flushed, or hot, a sensation known as the niacin flush. But shortly afterward, those same vessels snap back and constrict suddenly. It's this violent push and pull on your circulatory system that creates chaos in the body. In seniors whose arteries may already be stiffened by age, this process is especially dangerous. The sudden dilation forces the heart to pump harder. Then, just as quickly, vessels tighten again, raising your blood pressure, disrupting circulation, and reducing blood flow to the brain. And when blood vessels narrow after expanding, the turbulence can disturb clots, break off plaque, or lead to many strokes, what we call TIAs, or transient ischemic attacks. That's exactly what happened to Frank. One morning he woke up disoriented. His words slurred for about 2 minutes, and then he returned to normal. His family brushed it off as dehydration or fatigue, but it wasn't. It was a warning shot from his brain. A temporary stroke caused by unstable blood pressure and vascular stress. When we did imaging, we found narrowing in several key arteries. No major blockage, but clear evidence of pressure damage. Combined with his niacin intake and mild dehydration, it created the perfect environment for clot formation. His brain was lucky that morning. Next time, the damage could be permanent. I told him the truth, gently but firmly. Frank, this supplement you thought was protecting your heart was quietly harming your brain. He was stunned. Like so many seniors, he assumed over-the-counter meant safe. He'd read that niacin was natural. He had no idea that anything above 50 millions of niacin per day should only be used under medical supervision, especially in people over 65 or those with high blood pressure, irregular heart rhythms, or any history of cardiovascular issues. And it's not just traditional niacin. Many people think they're safe with flush-free or extended-release versions sold online. But even those forms can raise blood pressure, trigger atrial fibrillation, or affect blood sugar regulation. And when combined with blood pressure medications or diuretics, the body's ability to maintain stable circulation becomes unpredictable and sometimes dangerous. In seniors where hydration fluctuates, vascular elasticity declines, and the brain becomes more sensitive to oxygen supply. Niacin's effects can spiral out of control faster than you'd think. The recommendation for adults over 60 is to never exceed 30 to 50 milligash day unless instructed by your doctor. And if you're on heart medication, especially beta blockers or calcium channel blockers, combining them with high-doses niacin is like playing Russian roulette with your blood pressure. Frank is now off niacin. We stabilized his pressure, supported his circulation naturally through diet and medication, and with time, he's regained full cognitive clarity. But he still remembers the scare. "Doc," he told me, "I thought I was doing everything right. I was reading labels. I was trying to stay off statins. I didn't know I was gambling with my brain." That line stuck with me. And it's why I'm sharing this with you now. Because too many older Americans are trying their best reading articles, following advice, and trusting supplements without realizing how differently their bodies respond to vitamins after age 65. You see, what worked when you were 40 or 50 doesn't always work in your 70s or 80s. Your kidneys filter slower. Your blood pressure is more sensitive. Your arteries are more fragile. Your brain demands consistency. Imbalance, not sudden changes in pressure or blood flow. So if you're taking a niacin supplement, especially for cholesterol, please stop and check the dosage today. Don't wait until your body whispers louder in the form of dizziness, flushing confusion, or a stroke. And if you thought niacin was surprising, just wait until you hear about a vitamin most people associate with prenatal health. But when taken by seniors in excess, it may actually mask early dementia and worsen nerve damage silently. 6-folic acid vitamin B9, folic acid vitamin B9 double-edged sword. At first glance, folic acid seems harmless, even essential. For years, doctors and public health campaigns have promoted it for preventing birth defects, supporting red blood cell production, and keeping your heart healthy. And while that's true for younger people, particularly pregnant women, what many older adults don't know is that too much folic acid, especially when taken through supplements and fortified foods, can quietly mask a dangerous deficiency that attacks the brain and nervous system from the inside out. I remember a patient of mine, Miss Judith Monroe, a 75-year-old retired nurse from Colorado. She came to me complaining of persistent fatigue, occasional memory lapses, and numbness in her hands and feet. She said her primary doctor thought it was just age or stress, and maybe early arthritis, but she knew her body, and something didn't feel right. When we reviewed her supplements and her diet, I noticed she was taking a popular senior multivitamin with 800 mcg of folic acid, along with fortified breakfast cereal and a protein drink each, adding another few hundred micrograms. Altogether, she was consuming over 200 mcg per day, nearly triple the recommended daily intake. At first, that didn't seem like a red flag. After all, folic acid supports heart and brain health, right? But when we ran her blood work, we uncovered the hidden danger, a severe vitamin B12 deficiency. Her folic acid levels were high, which was masking the telltale signs of B12 deficiency in her red blood cells. And while her blood counts looked deceptively normal, her nerves were quietly breaking down. Here's what most people don't realize. Folic acid and vitamin B12 work together to maintain healthy nerve function and red blood cell production. When you get too much folic acid, especially from synthetic sources like supplements and enriched foods, it can correct the anemia caused by B12 deficiency without fixing the underlying problem. That means your doctor might not catch the B12 issue until nerve damage has already started. And in older adults, the ability to absorb vitamin B12 naturally decreases with age, especially for those on acid-reducing medications or with gastrointestinal conditions. So when high folic acid masks the signs of B12 deficiency, the damage continues silently. Numbness, tingling, poor balance, memory loss, even confusion or dementia-like symptoms. And once nerve damage sets in, it can become permanent. In Judith's case, we caught it in time. We stopped the high folate supplements, adjusted her diet, and began B12 injections. Within weeks, her energy returned. The numbness in her hands improved. And one day, during a follow-up, she held my hand and said, "I was taking everything they said was good for me, and it was tearing me down from the inside." This isn't rare. In fact, studies now suggest that many seniors in the U.S. are unknowingly consuming excess folic acid from fortified grains, protein bars, and senior-targeted vitamins, while their B12 levels quietly drop. It's a mismatch the body wasn't designed to handle, and it's putting thousands of aging brains at risk. If you're over 60, taking a multivitamin and eating fortified foods, I urge you to have your B12 levels checked regularly. Never assume more is better, especially when it comes to synthetic folic acid. The recommended daily allowance for folic acid is 400 mcg, and anything above that should be medically necessary and carefully monitored, because your brain, your nerves, your independence, they all depend on balance, not blind trust in a label. And if a simple vitamin like folic acid can quietly mask something as dangerous as B12 deficiency, just wait until you learn what's really going on behind the scenes with vitamin C, a supplement nearly every senior trusts, but one that may be pushing your kidneys and blood vessels closer to harm than you realize. If you're still watching and finding these insights valuable, please comment number 1 below to let me know you're here. Now let's keep going with point number 7. 7. Vitamin C. Too much of a vitamin C. Good thing. Vitamin C. It's the one vitamin that nearly every senior I meet swears by, and I understand why. For decades, it's been portrayed as the ultimate defender. Fighting off colds, boosting the immune system, improving skin, and even protecting against aging. It's found in chewable tablets, fizzy drink powders, immune-boosting gummies, and multivitamin packs. Sometimes in doses 10, 20, even 30 times higher than what the body actually needs. But what if I told you that too much vitamin C, especially when taken daily in high doses, could damage your kidneys, harden your arteries, and trigger the very health issues you're trying to avoid? What if I told you it could help form blood clots in people already at risk, especially those over 65? Let me introduce you to Mr. Robert Langston, a 78-year-old former auto mechanic from Indiana. He came to see me complaining of frequent back pain, fatigue, and trouble urinating. His blood pressure had been creeping up, and his primary doctor had ordered a kidney function test. The results were troubling. His creatinine levels were rising, his eGFR was dropping, and imaging showed signs of tiny stones beginning to form. Robert didn't smoke, didn't drink, and had always been active. But when we reviewed his daily routine, something stood out. Every morning, he drank a Mega Ose immunity shot from a popular brand containing 500 million of vitamin C. At lunch, he took a multivitamin with another 500 million. And sometimes in the afternoon, when he felt tired, he'd dissolve an immune-boosting powder in his water, another 1,000 ml. All in all, over 3,000 ml per day, every day, for nearly 2 years. Now here's what many seniors don't know. Vitamin C is water-soluble, but that doesn't mean your body can endlessly flush it out without consequences. In high doses, vitamin C breaks down into oxalates, which are sharp crystallol-like compounds that can accumulate in the kidneys. Over time, this leads to kidney stones, irritation, and decreased kidney function, especially in older adults whose filtration systems are already slowing down with age. But the risks don't stop there. Studies have shown that excessive vitamin C may promote calcium buildup in the arteries, particularly when combined with calcium supplements or high-dose vitamin D. That calcium can form plaques, narrowing the arteries and increasing the risk of hypertension, heart attacks, and blood clots. In Robert's case, not only were we seeing kidney distress, but a scan also showed early signs of arterial calcification in his abdominal aorta, the body's main highway of blood flow. His immune system wasn't the issue. It was his misguided belief that more vitamin C was always better. I still remember his face when I explained what was happening. He looked down at the bright orange packet he pulled from his coat pocket and whispered, "I just didn't think something so simple could do this. This isn't rare." In fact, many older Americans are taking over 2,000 millimeters of vitamin C daily without realizing it, stacking it from different sources. Multivitamins, fizzy drinks, gummies, energy packets, and cold prevention kits. But the recommended daily intake for older adults is just 75 to 90 milligrams per day. That's about the amount you get from a small orange and a handful of vegetables. Anything more than 500 milligrams per day, especially long-term, should be taken only under medical guidance and with careful monitoring of kidney function. Your kidneys are quiet organs. They don't cry out until they're in trouble. And when damage is done, it's often permanent. That's why awareness matters, especially at a time in life when the margin for error grows smaller. Robert adjusted his supplement routine. We reduced his vitamin C intake to under 250 ml per day, focused on hydration and real food. And with time, his kidney markers began to improve. But the stone risk still lingers. "I just thought I was protecting myself," he said at our last follow-up. "But I was putting myself at risk." If you're using high-dose vitamin C regularly or combining several immune boosters, please stop and speak with your doctor. Ask for a kidney function panel. Check for hidden sources of vitamin C. The goal isn't to scare, it's to protect. Because your immune system doesn't need megadoses. It needs balance, hydration, sleep, and nutrients in their natural forms. And if you thought vitamin C, the most harmless supplement on the shelf, could lead to kidney stones and hardened arteries, just wait until you hear what's hiding in your healthy greens powders and joint support supplements. Vitamin K might be natural, but when mixed with blood thinners, it becomes a silent and deadly trap. 8. Multivitamins. The hidden multivitamins cocktail. For millions of older Americans, multivitamins feel like a safety net. Something simple and harmless to cover your bases. Every day, I see patients who begin their mornings with a glass of water and one small pill that promises daily support or complete nutrition for seniors. The labels are friendly, the branding is reassuring, and we're led to believe we're doing something responsible. But what if I told you that many multivitamins, especially those marketed to older adults, are actually complex cocktails of mega-dosed ingredients that your aging body can no longer process safely? That was the case for Mrs. Jeanette Wallace, a 73-year-old retired church secretary from Indiana. She came to me complaining of headaches, blurred vision, dizziness, and occasional confusion. She said she'd been feeling off for months, but couldn't quite explain why. She had no major illnesses, no alarming scans, no known neurological conditions, but something was clearly wrong. When I reviewed her medication and supplement list, I noticed she was taking a popular senior 50+ plus complete multivitamin. The bottle was colorful and promised memory support, heart health, bone strength, energy. Everything an older person might want to protect. But the actual contents told a different story. It contained 3,500 IU of vitamin A, 1,000 IU of vitamin D, 60 milligrams of vitamin E, 100 milligrams of vitamin C, 20 milligrams of B6, and 35 milligrams of niacin, all in one daily dose. That doesn't include what she was already getting from her diet and other supplements. Individually, each of those vitamins can cause problems when taken in excess. But when combined day after day in a body that metabolizes nutrients more slowly with age, they can quietly build up and overload your system. The symptoms of this overload aren't always dramatic at first. Sometimes it starts with fatigue fogus or poor sleep, but over time it can become more serious. High calcium levels from too much vitamin D, increased blood clot risk from high niacin brain pressure from excessive vitamin A, or thinned blood from too much vitamin E. And let's not forget it forms blood clots. When blood vessel linings become irritated or hardened from long-term inflammation, often driven by oversupplementation, they become the perfect setting for a clot to lodge, especially in the brain. In Jeanette's case, it wasn't any one vitamin causing her issues. It was the accumulation of several, none of which her doctor had prescribed. And because she'd been taking them for years, her body had gradually become overwhelmed. We removed the multivitamin, reviewed her actual nutritional needs based on labs, and shifted her to a food-first approach. Within 6 weeks, her symptoms began to ease. Her vision cleared. Her balance returned. "I thought I was being careful," she told me, "but I didn't realize I was feeding myself a slow poison every day." What most people don't know is that the supplement industry in the US is lightly regulated. That means most over-the-counter multivitamins are allowed to contain doses well above the recommended daily allowance, especially when labeled for energy focus or anti-aging. And as we get older, our kidneys, liver, and digestive systems slow down. We don't process excess vitamins like we used to. What we don't use, we store. And what we store over time can cause harm. So if you're taking a daily multivitamin, especially one for seniors, take a close look at the label. Add up the doses. Cross-reference it with other supplements you may be using. Then talk to your doctor about what you actually need. Because in medicine, more is not always better. Sometimes more is exactly what pushes us over the edge. And if a simple one a day, multivitamin can carry this much hidden danger, imagine what happens when one single vitamin found in green superfood powders and leafy vegetables starts interfering with your blood-thinning medications without you even realizing it. Let me tell you about vitamin K, the quiet disruptor you never see coming. Vitamin K9. Vitamin K, the quiet disruptor. If there's one vitamin that flies under the radar, it's vitamin K. You don't see flashy commercials for it. You probably don't hear your doctor talk about it much. It doesn't promise more energy, better sleep, or glowing skin. And yet, for seniors especially, those on blood-thinning medications, vitamin K can quietly become the most dangerous vitamin in your entire cabinet. Vitamin K plays a crucial role in blood clotting. Your body uses it to help seal wounds and stop bleeding, which is important. But as we get older, many of us are prescribed anticoagulants like warfarin, Coumadin, Eliquis, or Plavix to reduce the risk of stroke or heart attack. These medications work by slowing the body's ability to form clots, making blood flow smoother through narrowed or stiffened arteries. But when you suddenly take in extra vitamin K, especially through supplements or green powders, it can block your medication from working, or worse, swing your blood too far in the other direction. Let me tell you about Mr. Dennis Hale, a 79-year-old former firefighter from Michigan. He was on warfarin for atrial fibrillation, a heart rhythm condition that increases stroke risk. His INR levels, the test we used to measure blood clotting time, had been stable for months. Then suddenly, he was rushed to the ER with a sharp pain in his chest, shortness of breath, and weakness on one side. It looked like a stroke. His blood was clotting faster than it should have, even though he hadn't changed his prescription. So what happened? As I sat with Dennis and his wife going over his routine, something stood out. A few weeks earlier, he'd started using a popular super greens powder that his neighbor swore by. It was packed with vitamins from spinach, kale, parsley, and other leafy greens, all loaded with vitamin K1. Each scoop had over 150 mcg, twice his daily limit on Warren, and he was taking it every morning, thinking it was giving him more energy and supporting his immune system. But what it really did was interfere with the Warren, causing his blood to thicken unexpectedly. The result, a clot that traveled from his heart to his brain. Yes, it forms blood clots, not because he missed a pill, not because he wasn't careful, but because a healthy greens drink changed his blood chemistry without warning. That's the terrifying thing about vitamin K. It doesn't come with alarms. There's no immediate reaction. It doesn't make your skin flush or your heart race. It just silently alters how your blood responds. And if you're on anticoagulants, it can undo the very protection your heart and brain depend on. Most people don't realize how inconsistent intake of vitamin K can wreak havoc on blood thinner effectiveness. One day, you eat a spinach salad, the next you drink a green smoothie, the day after you skip both, and your INR levels swing wildly. These fluctuations can lead to internal bleeding if your blood is too thin or life-threatening clots if it's too thick. Dennis was lucky. His stroke was minor. We adjusted his diet and moved him to a newer anticoagulant that's less sensitive to vitamin K levels. But many aren't so fortunate, and most never think to ask about the innocent vitamin. Hiding in their wellness powders, green drinks, or multivitamins. If you're on any blood-thinning medication, you must talk to your doctor before adding any supplement or major dietary change that includes leafy greens, green powders, or high vitamin K foods. Even a handful of parsley or a kale smoothie can tip the balance if you're not careful. What's most heartbreaking to me is how many seniors, well-meaning, proactive, careful seniors, are never told that something as quiet as vitamin K can shift the entire chemistry of their blood. And now that we've walked through all 9 hidden risks from vitamin D to vitamin K, you might be wondering if so many common vitamins can hurt me. What should I actually do to protect my brain and body as I age? What I'll tell you next is the most important part of all, because it's not about fear. It's about finally understanding what your older body truly needs and what it absolutely doesn't. Final wake-up call. What your aging body really needs and what it doesn't. If you've stayed with me through all 9 of these hidden vitamin dangers, I want to thank you not just for listening, but for caring about your health in a way that truly matters. Because this conversation isn't just about pills or numbers on a bottle. It's about you. Your brain, your independence, your ability to move, think, speak, and live fully as you age. And I'll be honest, this is the conversation I wish every senior in America could hear. For decades, we've been sold a beautiful illusion that vitamins are safe, natural, and essential. That more is better. That taking a pill every morning will somehow protect us from the hardships of aging. But what we haven't been told, at least not clearly enough, is that your body at 65, 75, or 85 does not work the same way it did when you were 30 or 40. Your kidneys filter more slowly. Your liver stores fat-soluble vitamins longer. Your nerves recover less quickly. And your heart and blood vessels are often more fragile. The truth is, you cannot treat your older body like a younger one. The rules have changed. And if no one told you that before, let this be the day you remember. What I've seen again and again in my own practice, from strokes that happened overnight to slow nerve damage that took years to show up to bleeding in the brain caused by a supplement meant to help the heart, is that most harm doesn't come from doing something bad. It comes from doing something good for too long without asking if it's still right for you. So many of my patients are smart, thoughtful, disciplined people. People who take their meds on time, eat their greens, walk every morning. but they end up hurt sometimes permanently because they trusted the label on a bottle more than they trusted the signals from their own body. That stops today because now you know the truth. You now understand that too much vitamin D can harden arteries and trigger strokes overnight. Vitamin E, when combined with blood thinners, can lead to brain bleeds. Vitamin B6 taken in excess can destroy the very nerves it's meant to protect. Vitamin A builds silently raising pressure inside your brain. Niacin, once praised for the heart, can spike your blood pressure and cause clots. Folic acid in high doses can mask B12 deficiency, leading to slow brain decline. Vitamin C, beyond a certain point, doesn't boost immunity. It harms your kidneys and forms oxalate crystals. Multivitamins, often marketed as safe, are cocktails of unnecessary excess. And vitamin K, so quiet, so subtle, can undo the protection of your blood thinners without warning. You now understand that it forms blood clots, sometimes slowly, sometimes suddenly, when the balance inside your body is tipped. You know that just because something is over the counter doesn't mean it's safe. You know that your aging brain and heart don't need more. They need what's right in the right amount at the right time with the right purpose. So what should you do now? First, take inventory. Pull out every supplement you're taking. The bottles in your kitchen cabinet, the powders in your pantry, the capsules you added just in case. Write them down. Add up the totals. Read every label. Look for overlaps, megadoses, and anything above 100% of daily value, especially for fat-soluble vitamins like A, D, E, and K. Second, talk to your doctor not just once. Make it part of your annual routine. Ask for blood work. Get your vitamin D and B12 levels tested. Ask if you truly need a multivitamin. Share everything you're taking, not just prescriptions. Let your doctor guide you, not advertisements. Third, go back to food. Real, whole, colorful food. Your body was designed to process nutrients in their natural form, in the exact combinations and amounts found in nature. Eggs for choline. Leafy greens for folate, salmon for omega-3s. Berries for antioxidants. Water for hydration. Your brain needs balance, not excess. It thrives on consistency, not chaos. And most importantly, listen to your body. It whispers before it screams. Don't ignore dizziness, tingling, confusion, or fatigue. Don't explain it away as just getting old. Getting older doesn't mean getting sicker. It means getting wiser, more aware, more protective of the body that's carried you this far. You still have time. You still have power. But you must choose knowledge over habit, clarity over confusion, and caution over convenience. You are not too old to learn something new. You are not too old to take back control. You are not too old to protect your brain. And I promise you, it's not the pills that make the difference. It's what you understand about them that saves your life. Thank you for walking through this journey with me. If any part of this message touched you, share it with someone you love. One conversation could be the reason they wake up tomorrow without a stroke, a fall, or a hospital stay. You are not alone. You are not powerless, and you are never too old to begin again with clarity, with purpose, and with the right kind of care. Let's move forward not with fear, but with wisdom. One step, one meal, one decision at a time. These lessons are meant to inspire you to live fully and authentically. Now I'd love to hear from you. Take a moment to reflect and share one thing you've learned and plan to apply in your own life. Let's support each other on this journey toward embracing these truths. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, and here's to living life on your own terms.